morning, everyone. How are we doing? All right, a big thank you to COGS. Is that how we do it? Pronounce it, COGS, and the leadership, and especially my good friend Bob. Bob, thank you very much. You've done so much for this community, and you're always out there. And well, I'll leave the rest for later on. But it's an honor to be here. This is really a mission of mine to really educate the Baltimore area and the Maryland area about brain health and dementia and what you need to do to take control of your brain health. Everybody say it with me. Take control.
Take control.
Oh, that's pitiful. Let's try again. Take control of your brain health. So we need to personalize it, so we say take control of my brain health. Okay? The reason I'm saying this is, and I'll get to it in a minute, but I honestly don't, it's hard for me to think of anything more important than this. And yes, everybody knows it's really, everybody agrees that their profession is important. But I think there's no other important organ than the brain. And I'll give you a brief background of myself. I live really in two worlds. I live in Nigeria, hence the accent. I treat kids with brain disorders and adults with brain disorders as well, virtually for the most part. But over here, and I have patients around the world too who come to me maybe as a last resort. How are we doing with my voice? How's my accent coming? Are you hearing me all right? Okay, cool.
It's good. Yeah.
It's good, thank you. And now I tend to speak fast, and I lived in Oklahoma for a few years, and I had to really learn how to slow it down. So sometimes I forget, I go back to my rapid speaking. But so like I said, I live in two worlds. In Nigeria and over here, I do a lot more of education and training, and really because again, the topic of dementia is becoming, as you well know, is a really big topic. But what I've seen is that a lot of people, even though they've gone through, maybe they've had a loved one who died because of dementia or some other brain disorder, many times I see that most people simply do not know what to do to prevent it. Now, if you ask somebody what to do to prevent a heart attack, most people will rule out a few things. Everybody knows, yeah, you need to exercise more, you need to sleep better, stress less, eat more healthy, whatever that means. At least it's something. But when it comes to dementia, it's like blank face, totally back, deer in headlights. And I feel that if we're going to deal with the coming storm, and I'm not being a little dramatic, but there is a storm coming, as you all probably know. It's already here, let's just be frank. It's the number one cause of death. I couldn't believe this. Growing up in medical school in Nigeria, dementia used to be this really a condition of the really old white person. Really old white person. I mean, we didn't even see cases of dementia. By the way, we didn't even see cases of autism when I was in medical school. Now, dementia is the number one cause of death. It makes no sense to me at all. It's going, well, this isn't the developed country. In third world countries like Nigeria, it is growing explosively. And the challenge that we have, and this is why I'm really concerned about it, the challenge we have is that we don't have all this nice social services. I mean, you look at the community, you have the architects, you have the home care partners, you've got the financial, we don't have any of those things. They just let people with dementia left to themselves. So we've got to figure out a way to fix this problem. We've got to find out what works and what is practical so that the rest of the world doesn't, because we have no safety nets, I promise you. I'm not going to read all this out, but as we all know, women are twice as likely as men to have dementia. Yeah, I had a few wows there. It's a big problem. Baltimore is number one in the country. In the country, number one. How many of you have heard this before? Okay, a few of you. All right, okay. So this is just the beginning, right? This is just the beginning. I got this from the Batman movie, and that's because people are looking at me and they say, this is the serious discussion. What are you doing showing a superhero movie? This is serious. Well, LinkedIn is a serious platform. And what do we have here? So, I promise you I'll get back to you, boss. Okay. The problem is everywhere. Like I've spoken at senior centers, I've spoken at projects about brain health and dementia. I've spoken at very, shall we say, elite social clubs in DC and Baltimore, and the same expressions I see every single time. People they're scared of dementia, of getting dementia. They're helpless to do anything about it, and they are ignorant about what to do about it. That's a tragedy, because for the most part, what is driving these rates, these increases, is what you're doing or what you're failing to do as a person. And this starts much earlier in life, and I'm going to get to it, especially in midlife. And most people simply don't know what to do to protect their brains, and so they're just doing what they know to do. They're just doing and hoping and keeping their heads in the sand and hoping nothing happens. Well, hope is not a strategy. $81 billion in the next, I think 2050 is 1 trillion. I think it's going to be much more than that. But that's not really it is a problem. But that, in my opinion, especially from what I'm seeing, working with people, loved ones and caregivers and all that, is the toll that it takes on the individual, the emotional, the physical toll. Probably heard the statistics, 32, I had 42%, recently I had 30%, whatever, it's still large. 30 to 42% of caregivers die before the person they're caring for does. Okay, does the stress and the strain have anything to do with it? Absolutely. But it's more than that. I have a friend whose father was on admission or in full care, memory care. Well, no, it wasn't all that yet. I think it was assisted living. $15,000 a month. Fortunately, the government was taking care of it for them. But then soon after he dies, his wife comes down with leukemia, and so she's being treated for leukemia now. Is there a connection? Well, she had a few fractures when she was taking care of it while he was still alive. So bottom line is that these things have an emotional and physical burden that far outweighs anything else we can see or measure. And so really what, again, I'm trying to say is that we need to take this whole thing, education, this whole training of the individual, of the people, of the lay people. You are going to have to take these things into your own hands. I know I'm still giving you some bad news. Hopefully that will change soon. But the number is increasing. So it's probably next year we're going to revise it. I heard this recently. Baby boomers are turning 80 next year, right? I mean, that's really good for the senior community like you guys, right? I mean, you guys, some of you are going to be killing, right? But at the same time, too, it's very, very important that we know what to do for people as well. So it's going to be worse among black people, and obviously with women too, it's going to be worse because you all carry the burden by far of dementia, whether you have the disease, more likely to have the disease, or your caregivers. 30% of all caregivers are actually daughters of people with dementia. So that's a huge burden. And again, I don't know why there isn't that much more shouting about it. This should be screamed from the rooftops. Why isn't this happening? Why isn't everybody talking about this? These are the three people that are most affected: veterans, blacks, and women. Okay, each of these has twice the risk or twice the rate of dementia as the rest of the population. Now, since I belong to two of these categories, it's especially pertinent to me personally. And just in case you're wondering, I'm referring to the fact that I'm a veteran and I'm black. Just in case you're wondering. So I present to you the solution. The solution is really simple and straightforward. And I obviously alluded to it. People need to be educated consistently, not just once in a while. We have someone come and give you a nice 45-minute talk about the brain. There's a lot more to it than that. It needs to be an ongoing thing, especially in senior and independent living homes, so that they in turn may know what to avoid and what to do. But it's not just, well, I take these pills in the morning, I'm fine. You also need to know when harm comes your way, or rather the way of your brain, and know what to do to mitigate it, to reduce the impact of the harm. Typical example, somebody plays football, we've all heard about CTE. If your kid plays football, we already know there's going to be some degree of brain damage. Now, fortunately they're young, so they can get through it. But what I say is everybody who is playing football, because of that risk, should be taking something like an omega-3 fatty acid supplement, which is it's an anti-inflammatory for the brain. That's just one example. If you have problems sleeping, you've got to address the sleeping, because insomnia is a big risk for dementia. So even if you haven't figured out how to get 6 to 7 to 8 hours of sleep a night, you need to know what to do to mitigate the effects of poor sleep on your brain. You can't just keep hoping that things will change. And I'm speaking to you women especially, because sleep is a big problem, especially for middle-aged women and above. Okay? People just take for granted, I'm taking care of the family, and that's how life is. No, you've got to fix your sleep problems. And those are just two of many examples that we talk about. So I've come up with a course, and this Keeping Your Marbles talk is just a 45-minute talk, just to kind of highlight a few things, let you have something nice to go home with. But really, there's a deep dive into it that we try to present to senior centers. I use the analogy of a fortress. So think of your brain as what's happening within the four walls of the fortress. And you have the moats, you have everything else. Your brain is under attack. If this were Game of Thrones, or what are the other ones now? Troy, The Lord of the Rings, or King, Friendship of the Rings, this would be chaos. You'd be seeing all kinds of activity and shooting and firing. But just so you can understand what we're trying to do, the idea is that what we know is that three things happen to people. When a person comes down with dementia, there are three things that happen. One, they probably have been exposed to greater attacks. Number two, their defenses, for whatever reason, are not as strong or protective as they should be. And this could be genetic reasons as well. And number three, when things begin to go wrong, they did not receive prompt medical care at the time they needed to. Those are the three. You can pretty much fit everything under those three things. Increased attacks, decreased defenses, and lack of prompt care. So our job is to help people reduce the attacks, but they need to recognize where those attacks are coming from. Number two, they need to know what to do to strengthen their defenses. And number three, know how to work well with your healthcare provider. In other words, know what tests to ask for. And again, this is contextual. As women, you get some tests you need to pay attention to, as opposed to men. And black men, black women, white men, there's another difference. Everybody has their own different risk factors. We'll get into that in a little bit. Just want to say something real quick about this, is that there's an Alzheimer's disease study speaking about protection of your brain. There's an Alzheimer's Association study, a few years ago, I think it was last year or 2 years back, that they identified one single nutrient that could help you reduce your risk of dementia by as much as 50%. Now, if you've heard about that study, don't tell me what that nutrient is. Don't say it out. If you've heard about the study and you know what nutrient that is, raise your hand up real quick.
What is it?
Well, I don't want to break my flow. We'll get to it, we'll get to it. So wait a minute. Seriously, how many of you have heard of that study? And you know what nutrient that is?
Is it the pointer study?
I don't know what it's called. But if it doesn't say, if it does not tell you one specific nutrient, then it's not a pointer study. So there's a specific nutrient by the Alzheimer's Association. So we're dealing with seniors here. We don't know what that one nutrient is. Okay, we'll get to it. So really, let's do a quick crash course in dementia. That's the bad brain is on the right. Is that correct? The good brain is on the left. Okay, just want to kind of get it all mixed up. Your job. So what happens? This is a crash course in dementia, right? This usually just takes about 2 hours. So I'm trying to compress this to like 5 minutes. All right. When a person comes down with dementia, they have lost over a third of their brain tissue. All right, that's a huge amount of tissue, a huge amount of computing power. For comparison, by the time you get to your 80s and 90s, you've lost 10% max. Okay, so this is a huge. So the person with dementia is not out to get you. They're not trying to be stubborn or difficult. They're not being racist. They're simply being, this is simply a problem of the brain not working like it should. A general definition of dementia is a syndrome involving decline in memory, thinking, behavior, and the ability to perform everyday activities. You can have perfect memory and still have dementia. Did you know that? Yeah, it's not always about memory. It could just be about your computing power, your ability to plan ahead, your ability to perform certain tasks, and so on. Or your memory could be intact, so it kind of affects different parts of the brain. So, Alzheimer's disease is just one of over 100 different kinds of dementia. Now it's estimated to be about 70 to 80%, maybe 60 to 70% of all dementias. But that's one we all hear about. And it is meant to be irreversible. We'll get to that in a minute. But let's talk about how the brain works. If you look at a heart, what do you see? You see the heart, it's beating, let's say you're in surgery, and some of you have probably been in surgery. In my past life, I was in several surgeries, including neurosurgeries. We did everything in Nigeria. Basically, the heart is like the shape of a fist, the size of a fist, and it beats rhythmically. Did I get that right? Rhythmically. All right, and it's 72 times a minute, and so on and so forth. For the rest of your life, very powerful organ. But you can get an idea of what it's doing because it's beating. You can't. If you looked at the brain at surgery, you don't see anything. But with the right instruments, what you see is, I call it controlled chaos, but it's extreme amount of activity. Things are scattered, there's no method but explosion. Brain cells are connecting, detaching, brain cells are forming stronger connections, and so on. All billions and billions and billions of activity per second. All right? And it forms what is known as a network or a circuit. And within that network, it comes down to one thing. The basic unit of brain function are two brain cells coming together and exchanging information. This has to happen to do anything from looking at your cell phone, to listening to me, to reading, to eating, to going to the bathroom. This is what happens, okay? This has to happen. Sometimes people think I over-exaggerated, but I'll get to why I'm exaggerating it so much. Your brain's health is measured by its ability to connect brain cells together. And they have to connect. Just as the heart has to beat 72 times a minute, there has to be continual connection and reconnection. You're listening to me and understanding and forming and making sense of the words that I'm speaking is all a factor of how well your brain is able to make those connections, as it does. Once that slows down, you might have to go to some people, when that gets affected, sometimes they think they have a hearing problem and they go to the audiologist to test their hearing and find out that no, the hearing is perfect. It's the brain that isn't connected like it should. So bottom line is connections make the difference. The greater the number of connections, the more powerful the brain. Just as in life, the greater your connections. So I'm willing to guess that the best connectors are the ones who are doing very well in their activities, right? They're the ones who are everywhere. I see Bob everywhere. I'm like, Bob, come on, man. Don't you have work to do? I mean, what are you doing? But connections are everywhere. That's what matters the most. And Einstein proved this the best when when they did he examined his brain. They found out that he had much greater connections between brain cells than the average person did. Yeah, part of that could have been genetic. Part of it also is because of the work he did with his brain. So the connections make the difference. But the problem is where we're getting to. The problem is that these connections, we're talking about 100 trillion connections in the brain, 86 billion cells, 100 trillion. That network requires a lot. Everybody say a lot. A lot. Beaucoup, lots of energy. It requires a huge amount of energy. I have this number here. This is not when the world is going to end, I promise. We probably wouldn't be here. But the brain is 2% of the body's weight. It requires 20% of the energy and the fuel and the oxygen and the glucose that comes into the body. It's a very, very small organ compared to the rest of the body, but it requires that much. 80%, 80% of the energy that the brain produces goes towards maintaining that network. Okay? So remember that network we showed you? So what happens when the energy supply is insufficient? Well, just think about it. If the brain is not receiving enough oxygen or it's not making enough energy, what happens is that the network is not going to be maintained as it should, and then that's when you begin to see things like, well, somebody somewhere in this room has experienced one or two of those things. I know I have, right? I remember I was trying to pump some gas and they asked me for my zip code, and I just went blank. I couldn't remember my zip code. I was almost panicking. Well, fortunately, it came back to me. But bottom line is that things happen, and it all has to do with energy supply. Also, difficulty following the conversation. We'll get to that soon. Asking the same question over. Sometimes it's not that they forgot that they asked. It's not that they forgot your answer. It's that they forgot that they asked the question in the first place. Okay? And they can tell the same story over and over and over again. For the most part, when energy supply diminishes, and we're going to connect this with dementia soon. For the most part, when the energy supply of the brain is diminishing, the first to go, the first to be sacrificed would be which ones? Which parts of the brain? Or which activities of the brain do you think? The frontal? You said the frontal cortex? Yes, the prefrontal cortex to be more exact, and that's the parts that have to do with planning, judgment, control, systematic activity, and so on. Parts that make us the most human, but also the memory parts. Basically, it's the parts that have the greatest connections or the densest connections, and also the parts that require the greatest amount of energy. Those are the ones that begin to, and really, and this is the key here, it's your brain that is beginning to cut back. You see, we think about Alzheimer's disease as a disease that suddenly jumps on you and it just shuts you down. It's like an invader coming from the outside and just shutting and killing your brain and dying. To some degree, that is true. But I'm here to tell you that after a certain point, to preserve itself, your brain begins to shut down those connections and synapses to preserve the energy for more important things, such as breathing, sleeping, and so on. Now, you will not hear this elsewhere in most places, and quite frankly, I've been banned and kicked out of certain places just for saying what I just said. So if any of you does not like what I just said, where's Bob? Right there. Okay. Take it off with him. All right. So I usually ask this question in group meetings. I say, which is more important to your brain, breathing or brain when your spouse's anniversary? Anniversary. That's a smart person over there. I remember I said that. I was speaking earlier at the Baltimore Estate Planning, their annual meeting, annual convention, and I asked the same question. And by that time, I hadn't been around people much. I hadn't understood the whole American humor. And then nobody asked a single question. Nobody said anything. And so I kind of looked up at my computer. I was like, okay, what's going on? Maybe they don't understand what I just said. Maybe my accent is off. So I looked up and finally, someone in the front seat was like, a man was like, and then I got it. So I was like, because as far as the men are concerned, either way you're dead. So I asked the same question. I went to a black church, or I guess predominantly black church, well, they were all black, and I asked them the same question. Right away, they said, of course, it's breathing. Oh, God, stupid question is that? And I was like, phew. Not all Americans are crazy. only the white ones. Hey, Bob is over there. So the question now is what drains? It really comes down to energy supply to the brain. What drains the brain of energy? I think that's where most of the research should be. If we are serious about preventing dementia, we need to know what drains our brains of energy and what to do to prevent that. Does that make sense? Wouldn't that be the right question to ask? Okay. So obviously it's aging. We can blame aging on pretty much everything, and that's a quick timeline. I'm not going to go into this much, but by 80 is 1 in 2 people will have dementia or Alzheimer's disease, and then it just goes on from there, especially in this country. I have this graph here. Basically, you can't really see the numbers. So vertically on the left side, 100% brain energy. That happens in your 20s. It's all downhill from there, okay? And that's the blue. The blue line is the more consistent line. That's for men. Basically, declines until about when you're 90s, when it declines, it goes to about 60 or 65% of brain energy. If you notice the pink line, the pink dotted line, is a steep decline. That's around the time of menopause. What we know is that hormones like estrogen and progesterone are extremely important for maintaining brain health and brain energy. For some people, that drop can be absolutely disastrous. Well, I mean, some of you may have experienced that, brain fog, impaired thinking, and so on, irritability, and so on. Some of you recover from it, and you could get back to normal. There are others who do not. The green line shows what happens when you add HRT, which is hormonal replacement therapy, with the right kind of, so if the physician knows what they're doing, and unfortunately only 1 in 5, I believe, only 1 in 5 OBGYNs know how to handle that transition period and provide you with the hormone that you need as a woman to maintain your brain health. Bottom line, what I'm trying to say is that your brain absolutely needs certain chemicals and nutrients to stay functional. And there are certain instances, especially as you grow older, that when you lose those very chemicals that have kept and maintained and supported your brain all these 40, 50 plus years, and you suddenly lose them, some people, it can be really bad and can set them on the path when you add other things, which I'll talk to you in a little bit. So the other thing is cellular damage or dysfunction, which happens to everybody. As we grow older, there's damage to our bodies. Some people recover, others don't. A lot of factors are involved. Everything from race, to lifestyle, to sex, by sex I mean the male-female sex, and so on. That they all factor in. And here's the definition. This is my favorite definition from the Alzheimer's Association, because I think it captures it. It's not perfect, but it captures it. It says it's a degenerative brain condition, disease that is caused by complex brain changes following cell damage. So what is the trigger? Cell damage. and then the brain now begins to have to respond to that cell damage. Sometimes it responds appropriately and it figures it out and it fixes it. Other times it doesn't. It's in the latter group that eventually progress to dementia. So I came up with what I call dementia's dirty dozen. Does anybody see any patterns here? What was that? Somebody said I. You got it, absolutely. So these are the things that kind of affect, that can lead to dementia. It took me a long time to figure it out. Some of them, I admit I had to try and finagle that a little bit just to make sure it fits into that eye and all that. But there's an ebook available, there's a QR code I can show you at the end. If you want to download it for free, you got it. And here's the process. So you can't really see it very well, I apologize, but at the very top we put the 12 dirty dozen, and then below that it says damage, and then below that it goes on. Basically shows you the progression from a healthy brain, maybe in the 20s, to what happens in your later on in your 60s or so when you eventually get dementia. It's not an immediate thing. It starts in your 30s or 40s, believe it or not. These things happen and your brain is trying to recover, and because you don't get prompt treatments, it just gets worse and worse and worse. And so we can highlight from that. I just want to highlight a few things. Speaking about these three groups we talked about. Veterans tend to have a higher rate because part of it is the exposure to the battlefront, blast injuries, head injuries, PTSD. When they recover, when they leave the military, trying to integrate into a civil society can be very, very hard for some of them, and that can lead to depression and isolation, and of course, drug abuse, alcohol, and so on. Blacks, our main problem, really, is cardiovascular disease. We are the kings, we're the priests, we're the queens when it comes to cardiovascular disease. Also, when it comes to prostate cancer and breast cancer as well. But for this talk, cardiovascular disease is a big problem among blacks. We know that over 80% of all dementias have a cardiovascular system involvement. All right, and of course, when women are concerned, it's a hormonal problem. That loss of the protective factors of your brain cannot be underestimated. It can be hugely important, but it's not just about menopause. There are several other factors that are involved, and I did a talk where we identified about 12 factors. You ask the average doctor, even the neurologist, they will basically say the reason why women have higher rates of dementia is basically because women tend to live longer, and they leave it at that. That's a tragedy, folks, because how will women know what to do if they're not being told what is causing this? Unless you all know where the risk factors are and what to do about it. Sitting ducks for a lot of people, unfortunately, especially in third world countries. So let's talk about, I call it an anatomy of a disaster because, again, many of these things are easily avoidable. I'm going to show you some of the things that happen to the brain. I'm going to use this as the example of a 71-year-old woman who came in with dementia. You look into her history and you see a whole bunch of different things. Difficult marriage, loss of her husband, loss of a loved one, stressful job, obviously nutritional deficiencies and so on, poor diet. I call it the pylon effect. And by the way, each of these can be fit under the dementia dirty dozen. So over the years and decades, these things begin to build and build and build, and finally the brain says, enough, enough. And the brain begins to shut itself down. It was doing so before. You are only now beginning to notice it when you can't find your way back home, or you can't calculate a tip like you should. So, and another thing I found when I came to Baltimore, which I was shocked about, first of all, they said, I heard people say, these are professionals, professors, telling me just as a matter of fact that you can't prevent Alzheimer's disease, right? And I was like, really? And also, you cannot reverse dementia. I was like, am I the Truman's Show? Am I going to wake up some next morning and I realized it was all a dream. Of course it can be. There's a whole bunch of things that can be done. I told you I'm going to say some things that will upset you guys, right? There's a lot. When I say reverse, I don't mean 100%. They're back on the field and running around and doing hopscotch and all that. I'm talking about to a certain degree, you can help a person with dementia. To a certain degree. Doesn't matter how far gone they are. I gave this example earlier on. Difficulty following a conversation. Now that's Kat Toops. She's a neuropsychiatrist. She came down with early stage Alzheimer's disease. She now treats people with dementia. Her problem was that the first sign was that she would be with friends having lunch or at the bar or whatever, and she found it so hard to follow what they were saying. So she thought she had hearing problems. Got her hearing tested, perfect hearing. Now went to the neurologist. Ran all the tests, early onset Alzheimer's disease, full blown. Luckily, she started looking for answers, which everybody should be doing. And you cannot accept the fact. Nobody should ever accept one doctor's opinion that there's nothing that can be done. As a doctor, I'm telling you that nobody should. They could get a second opinion, get a third opinion. ChatGPT is now out there. I know it has its flaws, but it can help you in your search. Anyway, bottom line is that she found out that there are actually doctors throughout this country, MDs, professors, highly recognized, who are actually addressing dementia. She learned from them. She used those approaches on herself. And now she's treating others, and she's doing research to prove these tests. Now, I came at it from a different angle. I started treating kids with brain disorders over a decade ago. And we basically, because they couldn't afford it in Nigeria, we were doing it free of charge. And eventually we got a lot of support from the government. Well, when I say for support, I mean permission was granted for us to do what we're doing, because we found out that the traditional, conventional methods of treating things like cerebral palsy, autism, simply were not working as they should. And besides, we're in a third world country, we couldn't do any of the tests, we couldn't do any lab rates, we couldn't do, even the medications were not available. So we had to figure out how to build a healthy brain from scratch. We had to learn what the brain actually needs to function. And we found out a lot of that had to do with the right kinds of nutrients in the right doses and the right amounts. And I would spend many times I would fly back and forth from Nigeria to the US to learn from, again, professors, doctors who are in the different fields. And what we found out is that it's not just the neurology field. You have to understand how to address the gut. You have to understand how to address the digestive system, the blood vessels, and so on. And the bottom line, we learned a lot, and we started treating all these conditions. The problem with dementia was that we didn't know how to fix it. We couldn't apply the same things we learned and were successful with the kids. We found out how to apply the same principles. We still fell short. It was only finally that we now realized that important factor, which was energy. We had to figure out a way to restore the brain's energy, to find a way to help the brain generate its own energy. And that was the final piece of the puzzle. So this is our approach when we're treating adults with dementia. So we address all this, about 7 systems, not just one, and that is the key. A quick story, I have a patient in Nigeria. Her son reaches out to me through another contact. Bottom line, global cerebral cortical atrophy. Basically what you saw in that picture, the brain was shrunken. Most people would say that's impossible. There's nothing that can be done about it. Well, because I had a few wins under my belt, I figured out what needed to be done. We bought a few nutrients, no medications. I do not use medications. Nothing against medications. I'm just more comfortable using nutrients and nutraceuticals. We shipped it back home. A few weeks or months, a few weeks later, he sends me a video of his mom getting up from bed and going to the bathroom by herself. This woman could not eat by herself before. She had to be fed, she had to be taken care of 100%. Now she's able to walk. And that's really a case about the amazing potential of the human brain and body. Something, unfortunately, modern medicine has not emphasized, in my opinion, like we should. The brain and body have tremendous ability to heal themselves, if you are given it the right tools and the right materials. It's not just about nutrients, obviously, movement, muscle building, and so on are very important, but this is really important. I need to round up now. So the two things you want to do if you're preventing dementia, you want to minimize damage. Again, if you don't know when damage or where the damage is coming from, you wouldn't know what to do about it. And number two, you've got to be thinking about your brain energy all the time. And whatever you do, you need to know how it affects your brain energy. Since we're talking about seniors, I just want to wrap up with this. 40, middle age seems to be the time when everything kind of like slows down and begins to go down. Everything from your cardiovascular health, your hormonal health, and so on. So we now know that people who get dementia in their 60s and 70s, the thing starts in their 40s or even 30s. Because that's when the weakness of the body coincides. In your 20s, you were able to withstand, you had all the protections and all that. You were Superman, right? You could bounce back, right? Or Supergirl. You could bounce back. Is that a Superwoman? No, it's a Supergirl that we know. All right, so you're able to bounce back easily. Now you cannot, because the natural forces are abating, and that's when these other things have a chance of causing damage. When I'm speaking to at senior homes especially, I emphasize these things. It doesn't matter if they're perfectly okay, we've got to focus on, these are the issues that we have to be concerned about. Falls, sleep quality, we need to address that. For women especially, white women especially, blacks don't have that problem as much, which is the hip fractures. White women tend to have less dense bones than black women. I never treated anybody with a hip fracture, except if they had cancer or something, or some secondary condition. So if I were king for a day, folks, I would insist that anybody who is coming into a retirement home, a senior living facility, should sign an MOU or a waiver or whatever it is, that they must have at least 3 or 4 hours, 3 or 4 times a week of physical exercise. Boot camp kind of stuff, make them work. Because that's what's going to help you prevent hip fractures. I tell you, many women, their bones just get weaker and weaker, and it just snaps under the weight of their own bodies, not from any physical exertion, unfortunately. All right, so we just need to know what to do, and I have a list of things that we emphasize. As you can think, as you can imagine, I always emphasize nutrient intake, because even if the senior is eating a right diet, their bodies are not digesting and absorbing and utilizing the nutrients like they did when they were in their 20s. Vastly different digestive system. So, in my opinion, everybody should be taking some kind of nutrient. I have a picture there, muscle mass matters. After I gave a talk on women and dementia, Joelle on the right, Jill on the left. Jill is Joelle's daughter. Joelle is in her 80s. She seemed very interested when I came to the muscle aspects, so she walks up to me after the class, and she says, she does this, and flexes, and she says, feel that. And I did. And folks, I don't remember what else we talked about after that. All I know is I said, yes ma'am, no ma'am. I am not going to mess with you. Okay, so let's wrap this up. I know we have a few questions. Dementia is an energy problem. It's not inevitable. It can be reversed. I have a few action steps. Processed foods are a problem, folks. Sugar is a problem. Do not take sleep for granted. You need to, if you can't fix it, find someone who can help you fix it. You need to have uninterrupted 6 to 7 hours, 17 hours actually sleep. Everybody needs to be on supplementation. Yes, by the way, number 7, vitamin D3 is the study that was done, and they found out that women could reduce their risk of dementia if they supplemented. high enough levels of vitamin D3 in their body, in their blood, they could reduce their risk by 50%. Why aren't you being told this? Why haven't you heard this? You know, if I were a cynical person, I would say there's something going on here. But I guess I'm not. I'm just naive, I guess. But why aren't you being told this? This is the greatest country on the planet. Everybody looks to you for answers. And we're not being told that something as simple as vitamin D is important. The other question I have is, well, if vitamin D is important, then what else? There are about over 200 different kinds of nutrients, vitamins, minerals, and so on. Could there possibly be other nutrients that can help to prevent dementia and protect your brains? You know the answer to that. You know the answer to that. Why aren't we talking about these things? All right, so I'm just going to end by saying, well, so we are. So like I said, I do have private consultations. I see patients virtually here around the world. I'm also very interested in getting this course out so that people can have a systematic approach to understanding what to do and how to do it based on their context. And I would love to speak at your event. Would love to discuss after this if you have any areas where you think I can talk or speak, especially to middle-aged women, because I think that's a sweet spot right there. You all need to know certain things. Okay, so back to this picture. It's your responsibility. It's not God's. It's not the government's. It's not your spouse's. It's your responsibility to keep your brain healthy. Your mission is to keep the left from becoming the right, and it all starts with going from this to this. Thank you very much for your time. Thank you. So, do I wait? Somebody can wrap it up?
We have a few minutes, so if anybody has questions,
Okay.
feel free, or.
Oh yeah. So, can I show the QR codes for the ebook if they want to get an ebook and all that? And then of course I do. Let me see. What does that say? So that's the Dirty Dozen ebook. If you want to download that, where I go through each of the Dirty Dozen. Then if you want to know about the course coming up, there's a QR code. Basically, it just tells us you want to be notified, and then we'll get back with you when it's ready. Questions?
I have one. What do you mean by insult in the journal?
I always get that question. Yeah, so that's the one I had to really finagle. So insults have basically toxins, basically chemical toxins. Everything from mold toxicity to air pollution and so on. Next. Yes, ma'am.
One of the things that you mentioned or that I saw there, what was important for women to exercise, and you specifically said leg exercise.
Yes.
So, expound on that a little bit. I started walking on my 12th week of 2.5 miles each day. But if you could just explain a little bit more about that.
Good, great question. So, bottom line, the more you move, the more weight you place on your legs, one, the more you build muscles, and number two, the denser your bones get. So, I don't know if you know this, but the heavier you are, the denser your bones will be. And I'm not saying you should get heavy just so you can get denser bones. But, again, another example is people who go on space flights outside the Earth's atmosphere, where the gravity is not so much, they have weaker bones when they come back. So bottom line, that impact is very important. But you can take it a step further by having someone train you or just show you what exercises you need to do to strengthen your legs and your hips, because the hip fracture is one of the worst things that can happen to an older person. Once that happens, it's a shock to the system. 30% of them will not recover and they will die within a year, and most of them will not return to normal function. So the antidotes or the prevention for that is continually strengthening the leg muscles and walking and putting load on it and exercising. Does that answer your question?
Yes.
Okay. Yes, sir.
Just to elaborate on her.
Yes.
I'm a physical therapist and this is what we do all the time.
Okay.
And the major thing we come across is people when we walk this many miles. But walking is good exercise for our body, like circulation, heart, endurance.
Are you hearing what he's saying? Walking is good. Okay.
Yeah. But along with the walking, you also want to incorporate strengthening exercise of your legs because you want the muscle to be stronger to hold your bones in place during the arthritis in the future,
Yeah.
fractures in the future. So you want to build up your muscle, not just by walking, but also incorporate 30 days of 2 to 3 times a week exercises your legs. For example, marching, side kicks, back kicks, squats, whatever you can do in your spare time.
Mm-hmm.
Add that to your walking so that it's not just your endurance buildup or circulation, but also the strength, which can help the bones to stay secure inside your strong muscles.
Great. Thank you very much. I mean, it's amazing, folks, just how much we're now finding out that muscle strength alone is super important for the brain. Apparently, the muscles actually secrete chemicals once you stress them. But they don't do it when they're not stressed. But once you stress these muscles, they produce chemicals that go to the brain and protect and keep the brain healthy. So there's a lot to be said for strengthening your muscles. Yes, ma'am.
You mentioned, you mentioned D3 K2 as a supplement that can really help reduce mention Alzheimer's. Is there a recommended dosage?
Well, yeah, this kind of nuanced answer. I mean, for my patients, I recommend something else, but this is a group thing, so it depends on people. I mean, what I will say is that the recommended allowance that is official is about 800 international units. In my opinion, that's too low, way too low, especially during the winter, because you're not making it much. But if you live in Baltimore, you are not making vitamin D. I hope you know that. Even if you go out butt naked, you are not making vitamin D. Okay, so you need to take supplements. For my patients during the winter, nothing less than 10,000. For my patients, I do not recommend anything less than 10,000. It's good to do a test, please. Tests. We don't have these tests in Nigeria, but I mean, over the years, we've learned that this works. All right? Yes, sir. Yes, ma'am.
Mine's more brand.
No, you're the sir. You're the sir, so go ahead. I was thanking her.
It's more of a nuanced question.
Yeah.
So you talk about in terms of what goes first in the brain, the dimension, you talk about the prefrontal cortex.
Yeah.
Which is technically the last portion of the brain to become fully developed.
Correct.
So why is it the first to go into dementia? Is it because it's the first for us to actually visibly see? It's more noticeable, or is it actually that's what happens?
That's a great question. I mentioned earlier that, so the prefrontal cortex, the parts that make us most human are also the parts that have the greatest density synaptic connections and therefore require the most energy. When the brain's energy levels begin to dip, it triages. It starts going into some sort of hibernation, and it basically cuts back on the synapses that are in the most dense parts, but also those are also the parts that are the least important for survival. That's the key I want to point out. The brain primary objective, like any other organ, any other animal, any other beast, the primary objective is to survive. So it's going to cut back and focus on the survival, the parts of the brain that it needs to survive, and disregard, so to speak, the parts that are, shall we say, luxury items. For instance, the private jets. If the company's funding goes low, well, too bad executives, you're not getting the private jet anymore. Go back to economy or first class. Does that answer your question?
No, that makes sense.
Okay.
Is it to survive?
Correct. Anybody else? Okay. Well, I just want to say thank you again, Lauren, Becky. The management.
Okay, well,
Don't leave before you check out. That's in the garage.
Okay.